So hello everyone, welcome to my new video. So today in this video, I will discuss with you all about a very important topic in our day-to-day OPD practice. So I'm talking about how to take history of a patient. So when you are in OPD, the first and foremost thing is to take the history of the patient. So it rely on you that how you are taking the history properly, and from that you will get an idea what is the patient condition, current condition, and according to that you can decide which investigation you need to send for the patient and what to do with the patient if you know the history properly, right? So that's today's topic for discussion. So, taking a very good history always helps you to focus on the examination, as well as it will tell you what are those investigation you need to send for the patient, right? So the gold standard of the taking history or taking a good history is to listen to the patient first and observe them carefully. It will help you to focus on the patient condition and impact of their suffering. So let's go to step-by-step manner. First, listen to the patient and observe them carefully. Then think about the possible cause of their suffering and then decide which investigation will help the patient. Okay. So here things need to be keep in mind before taking or asking questions to the patient. Right. So before asking question to the patient, just give you a brief introduction about yourself, that who you are. So if you are an optometrist, give a very brief introduction that I'm an optometrist here. I will check your eye first, and then ophthalmologist will check the eye. And if you are an ophthalmologist, then do the proper self introduction to the patient and also tell that what you are going to do with the patient, so that patient will get an idea that what is going there. Okay. So avoid using medical term to the patient and ask those questions in a very simple manner so that the patient can understand it very nicely. Okay. So always listen to the patient and don't interrupt the patient in between. Make an eye contact with the patient, and if there is need to ask questions like open-ended or close-ended, do that in a professional manner, and you need to see the things from the patient point of view. Whatever the patient is saying, you need to see these things in patient point of view. Okay. Now, these are the parts of a complete history taking process where you can see first it is starting from patient demographic data, then chief complaint, history of presenting illness, past illness, general medical history, family history, medication history, allergic history, social history, and birth history if the patient is a child. Okay. So we will go one by one of each and every part so that we can understand which part signifies which thing. Okay. Let's go. So here, patient demographic data. So ask the patient their name, address, so that you will be sure that you are dealing with the right patient. Okay. If there is two patients with a similar name, then ask their father name or and match from your folder. Ask the patient occupation, and this thing will help you to know the patient visual need, and also it will help you to get the idea of an eye symptom as a result of an occupational hazard. Okay, so here let's go to the chief complaint then. So here, ask the patient the reason of coming to the clinic. Record the complaint in patient language without using any medical term. So, as an example, if I give you the example, suppose the patient came to the hospital or came to the clinic for pterygium removal surgery. So, you can write in history part like mass lesion growth from nasal or temporal side towards the black portion of the eye. Here, the black portion means corneal side. So, here you need to write it like mass lesion growth from nasal or uh, temporal side towards the black portion of the eye since 4 months in the right eye or in the left eye. So you need to write the complaint in a chronological order. Okay. So whatever the patient say in the first thing, that is the chief complaint, and write it accordingly. Suppose the patient is saying redness, ocular pain, and blurring of vision. So the first thing the patient told is redness. So it will come first. Then ocular pain, then blurring of vision. So you will not write blurring of vision first. Write in a chronological manner so that it will be easy for other people to understand what is the patient chief complaint and where we need to focus properly. Okay, this is history of presenting illness. So this is simply the elaboration of the presenting complaint in a detailed manner. So tell the patient to explain the condition and write the presenting condition in elaborated manner. And while taking the history from the patient, make a possible diagnosis in your mind. For every complaint, ask the patient about the following questions like onset. It means sudden or gradual onset. Course means how long it is progressed. Duration means how long time the patient is suffering with the complaint. Severity of the condition. Location, where is the pain, where it is happening. And ask about any associated symptoms, any similar problem that patient faced previously, and previous ophthalmic consultation or current medication. So never keep asking this question that previously the patient went for other ophthalmic consultation or not, and what the diagnose. And if the patient is having previous ophthalmic consultation, then see the old record also, that what is diagnosed previously and what are those medication the patient is using right now. So you need to write it all these things in the presenting illness, okay, section. Now, this is the history of past illness. So here, also ask the patient about history of similar complaint in past. So this thing is important in the recurrent conditions like herpes simplex keratitis, uveitis, or recurrent corneal erosion. So history of similar complaint. Also, you need to ask about the history of similar complaint in other eye, like in case of uveitis or cataract. You will ask to the patient about history of past trauma to the eye, and also this thing will tell you the cause of cataract or retinal detachment if the patient say that he had a trauma to the eye this a specific period ago. Then you will ask the patient about the history of previous eye surgery performed to the eye, like cataract surgery, glaucoma surgery, retinal surgery, or squint surgery. Any surgery performed or therapeutic penetrating keratoplasty like surgery, like corneal transplantation happened, or DSEC, DMAC, anything happened previously. Just ask the patient and also document it properly. So if I give you the hint or tips for you, then suppose the patient came to your clinic and you are doing conversation with the patient or asking questions, many questions to the patient. So, and while asking many this question to the patient, then definitely you should see once the statement in a brief manner. Just the patient is talking to you and see the statement first in the first time. Then you got an idea that what is the ocular condition the patient is having right now, whether it is the patient is having congestion, whether it is diffuse congestion or circumciliary congestion. You will get an idea that okay, fine, patient is having this eye findings in a brief slit lamp examination in the initial history taking part, and then you are matching the patient complaint with your thinking that what can be the diagnosis. Okay, here first thing is you need to listen to the patient properly. Second, see the patient properly, that how the patient is appearing, how he is coming to the clinic, and how he is talking, how he is touching his eyes, how, where he is, is saying that where he is pain, location, severity, all those things. Then make a possible diagnosis in your mind, and also think that what are those conditions or what are those investigations you will need to send for the patient that will help the patient properly. Okay, so this thing you need to ask properly. So also ask the patient about the other associate eye conditions. Okay, so here, if the patient say that he is having redness or ocular pain, along with he is having floaters. So here you need to write also floaters, and it can be uveitis as well as it can lead induced to vitreous inflammation, vitreous opacity. That can also lead to such kind of condition. So you need to correlate all the such things very nicely. Okay, so here. General medical history. So here in general medical history, ask about the past medical condition. So this include the conditions like disease like diabetes, hypertension, HIV, asthma, or coronary artery disease, thyroid, tuberculosis, all such systemic condition you need to write in this general medical history section. Okay. Then family history. Here, ask the patient whether any family member of the patient has a similar eye condition. So this will help you to find out the familiar predisposition of inheritance ocular disease like glaucoma, retinoblastoma, diabetes, or hypertension. So definitely you should ask the patient whether any kind of family member having any similar eye condition or not. Okay. Then medication history. Ask the patient about the present, past used medication for eye as well as for systemic used medications. So do not overlook any medication that the patient stopped using sometimes ago that can relate to the patient's current ocular condition. So medication history also help you to know about the patient compliance towards the medication, how he is using or frequently using medication. As an example, suppose you diagnose the patient he is having glaucoma and previously also the patient used anti-glaucoma medication and suddenly he stopped using medication. So this knowledge or this thing giving you the idea that the patient had used anti-glaucoma medication previously, but he is not that much good candidate for all such things. He is not using an LGM regularly. So proper counseling is very much important for those kind of patient because if he is having glaucoma diagnosed and if he is not using LGM, then it can lead to unwanted IOP elevation that can lead to hampering of his vision. So that's why proper idea about the medication is very much important. Then ask the patient about any allergic history, whether he is allergic to any drug or any specific food. So all such thing will help you that which drug you will select to give the patient. Okay. Then social history. Here you will ask the patient that whether he is doing any habit of smoking alcohol or since how long time he is doing alcohol intake and such things. So this is the birth history that you need to look at properly. So here if the patient is a child, and then in every child, you need to take the birth history properly. Where you, in birth history, you will ask the patient that at what time period baby born. Okay, so you need to ask this thing to the patient, and whether it is full term cesarean delivery or full term uh, normal delivery, you need to ask the patient. Then also, this is the birth weight. So birth weight indicate that how what was the weight of the child, then birth cry, immediate or delayed birth cry, history of NICU for how many days he was in NICU. That is also very important finding. So history of postnatal infection, history of jaundice, history of fits, vaccination status, whether it is completed, ongoing, all such things you need to write it in your history section properly. Then parental consanguinity. So it means that in many people, it is seen that cousins are doing marriages or brother sister did marriage. So in those kind of marriages, the child born have some genetical inheritance disorders. So that's why taking this history is also quite very important. Then developmental milestone, like when here you will ask the patient that ev- whatever the child had developing is like walking, seeing, or tracking object. All these things are going on proper time bound manner, or whether there is any delayed things are going on. All such things you need to ask the patient parents or the attendant properly. Okay. So that's all, friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. And I hope this little session on what to say history taking help you a lot in understanding about the history taking procedure properly to you. Okay. So thank you so much. And very soon I will upload this video on YouTube also. Thank you so much.